video is for respiratory and heart assessments. First thing that I'm going to do, because the heart and the respiratory system, you can see it on the membrane, so I'm just going to look briefly on the eyes and the lips to see if there's any cyanosis, because that is connected to circulation and difficulty in breathing. That means the oxygen is not going on good. So far, I don't see any cyanosis, so I'm going to move down, just general assessment of the chest. Just, just sit up straight nicely, just breathe. You don't have to do that deep breath. So, general assessment of the chest, everything is symmetrical. I don't see any diversion or any side that is on the side. Everything is looking good. His respiratory even and ease. He's not using his accessory muscles, and his breathing is not labored. I'm going to just look as well for the capillary refill, and this goes to with the heart and the respiratory if there is any issues, so that is good. Now I'm going to move on to just like palpation. So this is the clavicular, and this is subclavicular notch, and it's okay. The sternum is good and straight. I don't feel any crepitus, any sounds, only feeling that. Okay, do you feel any tenderness? Is it tender when I'm
it's firm.
touching? Okay. All right. I don't feel any, he's denying any tenderness. There's no bulges, there's no depression, there's no masses on the chest, front and back. Everything looks okay. And now I'm going to check his breathing. Can you breathe? Okay, all right. That looks good. Okay, now I'm going to do a tactile parameters. What I want you to do is, I'll say 99, and I want you to repeat after me, okay? 99,
99,
99,
99,
99,
99,
99,
99,
99.
99.
Okay. All right. Now I'm going to check your trachea. This is your trachea here, to make sure that it's not deviated or you don't have anything around it. Okay. Do this side first. Subclavicular notch looks good, and there's nothing on there, so that is. Fold your arms. Lean forward. I'm now going to listen to the sounds of your chest just by tapping the back of your back. Okay, lift up your arms for me. Put down your arms. Okay, all right. Okay, now I'm going to do diaphragmatic excursion. What I want you to do is sit up straight. Okay, breathe, breathe, breathe yet. Don't hold it yet. Hold, breathe. Okay, now I want you to take a deep breath and hold it. Okay, breathe. Breathe, just breathe normal. Okay, now I want you to take another deep breath and hold it. Okay, let it out. Breathe. Normal. Okay, I'm going to come to the other side too as well. You okay? Okay. Now I want you to take another deep breath and hold it. Let it out. All right, you okay? And then I want you to take another deep breath and hold it. Okay, all right. So now I'm going to measure different sounds of resonance. Okay, 3 centimeters on your right and 2.5 centimeters on your left, and that is normal. There's nothing wrong with that. Now I'm going to listen to your lungs. I'm going this, let's see. Okay, this might be cold. Okay. I want you to take a deep breath, let it out, deep breath, let it out, 20, deep breath, deep breath. Okay, lift up your arms, both sides. Deep breath, let it out. 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 Now I want you to cross your arms and lean forward. Deep breath. 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 Okay. The lung sounds are good. They don't have any sounds that you're not supposed to be having. They are very clear. Now I'm going to do a voice resonance. What you are going to do is repeat after me. When I'm saying say 99,
99,
99,
99,
99,
99,
99,
99,
99,
99,
99,
99,
99,
99,
99.
99.
Okay, good. Now I'm going to make you sleep on the couch so that way I can check your heart. Okay, I've already done the general inspection as I was looking at your chest for respiratory, and I didn't see any issues or any abnormalities with your chest. Now I'm going to feel for your apex by touching, and this is a mitral pulse, and then I'm measuring the heart, and I'm going to feel for your aortic as well. Okay, then now I'm going to feel here for your aortic and feel here for your pulmotic. This is the pulmonary area on the third space as well. Fourth space is your ventricular. And the fifth space is your mitral valve, which is the apex and which is also known as PMI. Now I'm going to listen. Before I listen, I'm going to feel for your carotid artery, and I'm going to measure it together with the apex pulse. Okay, all right. Now I'm going to listen to your heart sounds. Starting at the aortic, pulmotic, pulmonary, ventricular, mitral, is known as apex PMI. I'm going to listen to your carotid. Okay, there is no abnormal heart sounds. There's S1 and S2. There's no S3, there's no S4, there's no murmur. His heart rate sounds to be within normal ranges, and there's no palpitations that were had. This concludes the video.